Why do some patients heal beautifully while others struggle for months? Let me explain. There is something most people don't realize about surgery. Everyone focuses in the technique, the precision, the expertise of the surgeon. And yes, those things matter. But surgery is only half of the equation. Healing is the other half. And if you can't heal properly, even the most perfect surgery becomes a problem. When we remove an infected tissue, place a zirconia implant, or extract a problematic root canal, we're not just solving today's problem. We're creating an environment where your body has to rebuild. Your immune system kicks into gear. Your cells start working overtime. Blood vessels need form and bone needs to integrate. Here's the problem. If your system is already compromised, if you're dealing with chronic inflammation, poor circulation, or your body is fighting multiple battles at once, that healing process slows down. That's where hyperbaric oxygen therapy comes in. What the research actually shows, the studies are clear on this. When you breathe 100% oxygen under increased pressure, what we call HBOT, your blood plasma carries up more oxygen than normal. This isn't just about getting more oxygen to your tissues. It's about triggering your body's natural healing mechanism. Research shows that HBOT does three critical things for surgical healing. First, it accelerates wound healing. The high oxygen environment stimulates the production of growing factors, like endothelial factor. This literally tells your body to grow new vessels. More blood vessels mean better healing. Second, it has a power antimicrobial effects. Anaerobic bacteria, the kind that cause the worst infection in the mouth, can't survive with high oxygen environments. HBOT doesn't just kill them, it breaks down their biofilm, those protective barriers that makes infections so stubborn. Third, it modulates your immune response. Instead of chronic inflammation that never resolves, HBOT helps shift your immune system towards healing and repair. Why this matters for dental surgery? Think about, we're dealing with biological dentistry. We're removing cavitations, infected bone that's been silently draining your immune system for years. We're extracting root canals that have been harboring bacteria in microtubes. No antibiotics can reach it. We're placing implants that need to integrate with bone that may be compromised. A study in diabetic wound healing, which is notoriously difficult, showed HBOT increased healing rates and significantly reduced amputation rates. At TRYBE, we don't just remove the problem and hope for the best. We create the optimal environment for your body to heal itself. That's why HBOT isn't an add-on service for us. It's part or is a must to how we practice biological dentistry. When you're dealing with complex cases, when you're being told your situation is hopeless, when other dentists have run out of options, that's when proper healing support becomes the difference between success and failure. Your body has an incredible capacity for healing and regeneration, but it needs the right environment. It needs adequate oxygen. It needs the anti-inflammatory process to resolve properly. It needs the cellular machinery to function optimally. HBOT gives your body what it needs to do what it's designed to do, heal. If you're looking for a practice that understands that healing is as important as surgery itself, let's talk. At TRYBE, we don't just treat teeth, we treat people. And people heal better when we support the biology, not work against it.